I'm Dr. Greg Walker, a physician with Cincinnati Children's Sports Medicine and Orthopedics. This is the first module in a series developed for youth coaches. In this module, we'll review how to safely remove an injured athlete from the field of play. Objectives. At the end of this module, you should be able to safely perform the following actions. Number 1, assess the athlete for injury. Number 2, understand if and when emergency medical personnel should be contacted. Number 3, correctly immobilize an injured athlete and understand when it's appropriate to remove protective equipment. And lastly, number 4, facilitate the transport of the athlete to a medical facility. Objective 1, assess the athlete for injury. Evaluate the athlete's ability to breathe based on answers to these questions. Number 1, is the athlete breathing on their own? Number 2, are the breaths labored? Are they struggling to get breaths? Number 3, watch the athlete's chest to determine whether the chest is rising with each breath. Determine where the injury is and the extent of the injury based on the answers to these questions. Number 1, where do you hurt? Number 2, do you have any back or neck pain? Number 3, if the injury is to the arms or legs, look for deformities. Is there any bone protruding from the skin? Number 4, feel for pulses in the injured arm or leg. Objective 2, understand if and when emergency medical personnel should be contacted. Call 911 immediately and keep the athlete in the field of play if, number 1, the athlete is unconscious or unresponsive. To determine this, simply ask questions such as, what's your name?
Hannah.
And what happened with your play? Number 2, the athlete is complaining of neck or back pain, which may indicate a spinal cord injury. Number 3, the athlete is unable to move arms or legs. Number 4, you can see exposed bone with a fracture or deformity. Number 5, a large joint such as the hip, knee, or ankle is dislocated. Number 6, you cannot feel a pulse in the injured arm or leg and there is a visible deformity. Objective 3, immobilizing the injured athlete. If there is concern for a spinal cord injury, number 1, focus on the head, neck, and shoulders. Number 2, maintain a neutral head and neck alignment with correct hand placement. Number 3, do not remove the helmet or shoulder pads. Objective 4, facilitate the transport of the athlete to a medical facility. Number 1, assign a parent or referee or other responsible adult to direct the emergency services personnel. Number 2, determine if there are any gates to be opened or other obstacles to be removed so EMS can get to the injured athlete. Number 3, notify the athlete's parents if necessary. Finally, if the athlete is conscious and not complaining of back or neck pain and able to move his or her legs, and there is no visible deformity of any joint or extremity and no exposed bones, you may allow the athlete to sit up. If the athlete has a leg injury and is unable to bear weight on that leg, you may assist them to the sideline. If the athlete is able to bear weight, ask them to go to the sideline for further evaluation. Review of objectives. We've covered how to assess an injured athlete to determine the severity of his or her injury, when to contact emergency services, immobilization, and facilitating transport of the athlete. I'm Dr. Greg Walker for Cincinnati Children's Sports Medicine and Orthopedics, and I thank you for your attention to these important tips and for your involvement in youth sports.